Hi all, my name's Kylie. I'm one of the respiratory therapists and certified respiratory educators with the Lung Health Program. So today I'm talking to you about what is COPD. So we're going to go over this together and hopefully you'll be a little more educated by the end of it. So like I said, I'm a respiratory therapist. I work with the Lung Health Program. I also work with the Ottawa Civic and the Ottawa General Hospitals, most likely the Civic right now. So I have some experience, about 13 years or so. Anyway, so let's get into it. So what we're going to do today, what is COPD? How is it diagnosed? Causes and signs and symptoms to look for. So first off, you can't really do anything more if you don't know what you're dealing with. So let's talk about normal lungs. So lungs, I like to always tell my patients, are like a tree, an upside down tree. The trachea is the trunk of your tree, with your main branches being the two main bronchi, and those go into the body of your lungs, which are filled with small bronchioles or small branches of your upside down tree, which lead to the air sacs or the leaves of your tree. And the air sacs are called alveoli. And this is where the oxygen passes into the blood circulation in your body. So this is where the oxygen from the air we breathe goes, through all the windpipes into these little air sacs, and the air sacs get the oxygen into your blood. And then the blood, of course, is the heart pumps the blood all throughout the rest of the body. And that's how we breathe and how we get oxygen to our cells. So then that begs the question, what is COPD? So COPD is a big blanket term that means chronic obstructive pulmonary disease. So it's a chronic disease that doesn't go away. Obstructive stops you from breathing well. Obstructive pulmonary, it stops your lungs from working well. So it's a common, preventable, and treatable lung disease. Includes a group of lung conditions, emphysema, chronic bronchitis, and it develops very slowly over time, okay? Develops from changes in the airways or the alveoli, resulting in airflow limitation, damage to the lungs. The damage to the lungs causes the air to breathe to go in and out of our lungs to become more difficult. So the damage progresses slowly and worsens over time. And the most common things to look for include shortness of breath and cough. The shortness of breath starting with exercise and kind of progressing. And then you can also have sputum and mucus production. So here we have two different kind of lung types or the COPD types we talk about. So there's the chronic bronchitis, which means it affects the airways themselves. So it gets them more swollen, you get more mucus, and that's what causes you to have harder time breathing because you can't get the air through these passages. The emphysema side takes place in the level of the alveoli or the little air sacs I was talking about in the last slide. So it causes the air sacs to get damaged where the air can't go in and out. And we'll see a little more on the next slide. So backing up a second, chronic bronchitis, damages to the breathing tubes or airways. So here we have a normal airway, nice and open, able to get air in and out. And looking at a chronic bronchitis airway, you see the swelling here, the muscles are inflamed and are further trapping the air. And then on top of, adding insult to injury, sticky mucus starts to form because it can't get in or out. So if you can't get it out, it's going to get stuck, it's going to get stickier, and then it's going to cause infections. So let's see here. Yeah, irritants make the airways red and swollen over time. Mucus or sputum, same thing. Mucus means sputum means mucus. Produce, and the inflammation makes it harder to get the air in and out of the lungs. Yeah. The main symptom of chronic bronchitis is a persistent, productive cough lasting more than 3 months. So that's your big thing right there. So then on the other side of it, the emphysema type lungs is damage to the alveoli or the air sacs. So irritants make the walls of the alveoli weak over time. The tissues break down and then they develop into larger areas or air sacs. The alveoli no longer have the elasticity to fill and empty easily when we breathe, and the air becomes trapped. So the main symptom of emphysema side is the shortness of breath. So once again, let's take a look at the normal lung. Normal. So air exchange that happens in the alveoli. Remember the little leaves of the tree I was talking about? So in the little air sacs, air goes in, carbon dioxide goes out, and then it goes into the little capillary beds that would be right here. That's not in the picture. And that's how we breathe, basically. Air goes in, carbon dioxide out, and then that gas exchange happens and the heart pumps the blood. So moving to the emphysema side, you have the alveoli here that is damaged. See how these do not look the same? The air does not pass through these walls into the capillary as well. So then what happens is that the carbon dioxide gets stuck in here, then the oxygen can't get in and the air becomes trapped, air exchange cannot take place, and therefore you can't breathe well. So there's another slide here. So explaining the idea of air trapping, the air can't get in or out well. So if you're looking at a normal balloon being normal lungs, lots of elasticity and blow up the balloon empties really easily, no problem. So if you look at the idea of a plastic shopping bag as your damaged alveoli, you know, you're not able, if you fill that bag with air, you're not able to get the air out, it just becomes trapped. So then that air trapping definition, abnormal amount of air left in the lungs when you try to exhale. Those alveoli, they don't recoil back, they don't snap back like they used to. They're stuck open, they don't do well. Anyway, so moving on. Diagnosing COPD. A breathing test is the big part. A breathing test, spirometry or pulmonary function test, is the only way to diagnose COPD. This test measures the volume of air flowing in and out of the lungs, whether there is airflow limitation. So there's been a couple of times where the people say they've been diagnosed with COPD on a chest x-ray or CT. You need to have this second part of the test to have a real diagnosis, because you can have emphysema on an x-ray, but if there's no limitation, there's no diagnosis. So the goal of COPD assessments is to monitor the level of airflow limitation over time. This is why we continue to ask you to come in and do breathing tests or to have repeat breathing tests, because you need to know, you know, how fast things are going or if things are relatively stable. Some people may have COPD but may not know it. So up to 50% of people who have COPD have never had a breathing test because their symptoms, being shortness of breath, because of their symptoms. Oh, okay, sorry. People tend to change their lifestyle and level of activity without being aware of it. This is the idea that it's a chronic, very slowly progressing disease. So you have it, you don't realize you have it, but you're changing your lifestyle. Instead of going up that set of stairs 4 or 5 times a day, I'm going to think about it twice. I'm only going to go up once if I need to. And then you feel you go up that set of stairs and you're like, holy moly, I'm short of breath. So you slow down. And that's that idea of you don't know you have it until you have a test for it, or you change your lifestyle without realizing it. You start doing pursed lip breathing when you're doing activities because you have to get that air out to breathe again. That's a different slide. I won't go into that. Sorry, causes of COPD. So most common factor is smoking, number 1. Those who smoke any form, tobacco, marijuana, pipe, cigar, have a higher number of breathing symptoms and lung function abnormalities. So that is number 1 right there. The other things, there's other things too. Indoor and outdoor air pollution, secondhand smoke, wood smoke, air pollution, workplace particles, chemicals, asbestos, dust, fumes, all these things, diesel, those are things that can contribute to COPD. Alpha-1 antitrypsin, rare genetic disease that can cause emphysema. This is very rare, but is, you know, becoming more in light these days. So if you are concerned about this, it's important to talk to your respiratory therapist or your doctor. So infections, history of severe childhood respiratory affected is associated with lower lung function in adult respiratory symptoms. And then asthma, it's now being proven if you have severe or undermanaged asthma, it can remodel your airways, causing permanent obstruction, causing COPD later in life. So it's important for you, if you have asthma, to have it treated well, because that inflammation over time leads to poor lung function. So then managing COPD, it is treatable disease, but there is no cure. While there's no way to change the damage in your airways, there are many things you can do to keep your lungs healthy going forward. Smoking. Quitting smoking is the only way to stop the damage from occurring in the lungs and slow the progression of the disease. Make your home smoke free. Even if you quit, but your partner's smoking in the house, it's going to worsen your breathing. Make that home smoke free. Okay, prevent infections. Every chest infection furthers the damage in your airways and lowers your lung function. Get your vaccinations. Stay away from visitors if they are sick. Regular hand washing. This is very important right now with COVID. And I'm sure anyone who's watching this is very aware of this. Exercise, one of the other things that we always recommend, especially if you're talking to a respiratory therapist, being active each day can keep your lungs strong and has been shown to prevent chest infections and symptoms and flare-ups. So exercise reduces your symptoms, makes you feel a little better, keeps your lungs strong, and prevents chest infections. Huge part of our treatment plan. And then, of course, breathing, inhalers and breathing treatments help manage symptoms, improve quality of life, and more of this will be discussed in other videos, okay? So that's it. I'm Kylie. I'm one of the RTs. It's been lovely chatting with you. If you have any questions, reach out to your health coach. Take care.